All right, let's talk pediatrics. If you're getting ready for the NCLEX, you know peds can feel overwhelming. I mean, there's just so much to remember, right? Well, today we're going to change that. We're going to take all that information and turn it into a simple, powerful strategy for acing your test questions, all by using a tool you already know, ADPIE, the nursing process. Let's get right into it.
So, this is the million-dollar question, isn't it? How do you tackle these questions when kids are just fundamentally different? You can't just take what you know about adults and shrink it down. It doesn't work that way. To get these questions right, you have to think like a pediatric nurse, because a child's body works on a whole different set of rules, and that difference is exactly where we need to start. You know, before you can even think about picking the right intervention on an exam, you have to understand why a child is at risk in the first place. Their unique anatomy and physiology, that dictates everything. It tells you what the real priorities are, from fluid balance to fighting off a simple cold. This is the foundation. If you get this, you're halfway to the right answer every single time. Okay, let's break this down, because this is where it all clicks. Think about these differences in terms of NCLEX questions. An immature immune system? That means a kid gets sicker way faster. Their airways are narrower, right? So something like RSV, which is just a cold in an adult, can become a full-blown respiratory emergency for a baby. And their GU system and skin, man, their kidneys can't concentrate urine well, and their skin is thinner, which means they're at a huge, huge risk for dehydration. The trick is to always connect these basic physiological facts to the immediate clinical risk.
And speaking of dehydration, this number is so important. A huge percentage of an infant's body is water, way more than an adult. Plus, they have a larger body surface area for their size. So what does that actually mean for you on an exam? It means that anything, and I mean anything, that causes fluid loss, like a fever, vomiting, or diarrhea, can become a life-threatening crisis in a shockingly short amount of time. This is always a top-tier pediatric priority.
So let's move into our ADPIE framework, starting with A for assessment. Listen, if there's one tip I can give you for the NCLEX, it's this. When a question asks what you should do first, the answer is almost always to assess. You have to see what's going on. You have to gather your data before you can jump in and act.
A huge part of PEDS assessment is being able to recognize rashes. You'll probably see this word exanthem. It's really just a fancy medical term for a widespread rash that shows up with an infection. Being able to look at a description of a rash in a test question and know what it's pointing to, that's a high-yield skill you've got to have.
And this table right here, this is pure gold. It's all about pattern recognition. The NCLEX loves to give you these little clues, these key words. So when you read Koplik spots in a question, your brain needs to immediately scream measles. If they describe lesions in different stages, some new, some old, some crusted over, you're thinking varicella or chickenpox. And those classic honey-colored crusts, that's your dead giveaway for impetigo. You got to burn these connections into your memory.
Here's another assessment finding that should set off alarm bells. Oliguria. It just means very low urine output. In a child, this is a massive red flag. It's one of the first and most reliable signs that they're getting dehydrated or their kidneys are in trouble. So if you see a question that mentions weighing diapers or it gives you a low urine output number, you should be thinking fluid status right away.
Okay, so you've done your assessment. You've got your data. Now we're at the D in ADPIE, diagnosis. When it comes to the NCLEX, this step is all about one thing: identifying the patient's number one, most urgent problem based on what you just saw. Ask yourself, what's going to harm this child the fastest?
Let's put this into practice. Here's a super common scenario. You've got a 2-year-old, high fever, vomiting, diarrhea for a whole day. They're losing fluid from every direction. You've assessed the situation. So what's the number one problem you have to tackle right this second?
It's got to be risk for fluid volume deficit. And the why is everything here. It connects right back to that physiology we talked about. Because this little one has such a high percentage of body water, all that fluid loss puts them at an extreme risk for getting dehydrated and going into shock. And fast. It's the most immediate physiological threat.
But hey, the NCLEX isn't only about the physical stuff. Let's look at another one. You've got a teenager, they have severe eczema, they're pulling away from friends, refusing to go to school. Okay, so the physical problem is the eczema. But what's the psychosocial priority here? Their behavior is your key assessment data. The priority here is disturbed body image. This is such a good reminder that pediatric nursing is holistic.
Especially with teenagers, the social and emotional fallout from an illness can be just as damaging as the physical symptoms. The NCLEX will absolutely test you on your ability to see and treat the whole person, not just the diagnosis.
All right, we've assessed the situation, we've diagnosed the main problem. Now it's time for action. We're at the P and I, planning and implementation. On your exam, this is where they ask you to pick the right nursing action. What are you actually going to do?
Now, before we get into anything else, let's talk about the single most important intervention for peds safety: meds. In the world of pediatrics, every single medication dose is based on the child's weight in kilograms. Period. No exceptions. The NCLEX loves to test this. You have to double-check your math every single time because a simple slip of the decimal point can be devastating. This is a core safety principle.
Okay, let's look at a common procedure, a lumbar puncture. Your role as the nurse is huge, and every single one of these steps is testable. It starts with positioning, getting that child curled up just right to open up the spaces between the vertebrae. During the procedure, you're helping maintain that sterile field and, just as importantly, providing comfort and distraction. And then afterwards, your job isn't done. You've got to lay them flat to prevent that awful spinal headache and keep a close eye on the site.
Itching, or pruritus, is a symptom you're going to see all the time with stuff like chickenpox or eczema. Your interventions here really have two main goals: making the kid comfortable and keeping them safe. The biggest danger is them scratching themselves raw and getting a secondary bacterial infection. So all of these actions are aimed at preventing that: keeping their nails short, putting little mitts on babies, cool compresses, oatmeal baths. It's all about comfort and protection.
And that brings us to the last and maybe most important part of the process: evaluation and teaching. In pediatrics, your work is never, ever finished until the family feels confident and capable of taking care of their child at home. This is a massive part of the NCLEX. So, picture this. You're discharging a kid who has something contagious. What does that family need to know? You got to talk about hand washing for everyone, how to clean toys and surfaces. You need to give them clear, simple rules for when it's safe to go back to school, like being fever-free for a full 24 hours without any Tylenol or Motrin. And you have to hammer home the importance of finishing that entire bottle of antibiotics.
Let's take another one, like preventing UTIs. This is almost pure teaching. Simple things, right? Wiping front to back, avoiding bubble baths because they can be irritating, pushing fluids, and reminding kids to go to the bathroom often. These are easy, actionable things that parents can do, and they are classic NCLEX teaching points.
This quote really just says it all, doesn't it? At the end of the day, family-centered care is the heart of pediatrics. Your amazing care plan means nothing if the family goes home and doesn't know what to do. Your role as an educator is every bit as critical as your hands-on nursing skills.
So let's put this all together into your game plan. For any pediatric NCLEX question you face, I want you to run it through this mental checklist. First, assess. What are the facts? What do I see? Then, diagnose. What is the biggest, most immediate threat here? Next, implement. Okay, what is my priority action? What am I going to do? And finally, evaluate and teach. Did my action work, and what does this family need to know before they leave? Use this framework every single time. It will keep you focused and on track.
This isn't just some theory to memorize. It is a practical tool. So here's my challenge to you. The very next time you open up your QBank and a pediatric question pops up, I want you to stop. Don't just scan for the answer. Deliberately walk through ADPIE, step by step. Assess the data, name the priority problem, find the priority action, and think about the teaching. That is how you build true clinical judgment. And that is how you're going to walk in on test day and absolutely master pediatrics.